Anal bumps causes. A variety of factors can cause one or more bumps to form on the anus. The anus is the end point of the gastrointestinal. It is where stool exits the body. A person may wish to better understand their symptoms by touching the anus and surrounding area. It is crucial to wash the hands before and after doing so to prevent the spread of bacteria. Anal fissures. Anal fissures are small cuts or tears that occur in or on the anus. They may result from passing hard stool, which can tear the delicate skin of the anus. When a fissure starts to heal, it can form a skin tag that may feel like a lump. An anal fissure may cause bleeding, often after passing hard stool, a burning or tearing sensation during a bowel movement, pain which may last for several days after passing hard stool. Treatment. If an anal fissure is not showing signs of healing, a doctor might recommend Botox injections or a simple surgical procedure called a sphincterotomy. Home treatment. To treat an anal fissure at home, a person can eat a high fiber diet, use temporary laxatives, use diltiazem ointment. Sitting in a shallow tub of lukewarm water can also help ease any discomfort. This is called taking a sitz bath. Hemorrhoids. Hemorrhoids are enlargements of anal tissue. They result from swollen veins in the rectum and anus, and they may be internal or external. Hemorrhoids are very common. They affect up to 75% of people in the United States at some point in their lives, according to an article in the World Journal of Gastroenterology. Symptoms of hemorrhoids include painless rectal bleeding, itching in the anal region, pain or discomfort in the area, especially during and after bowel movements, swelling around the anus that may form a lump. Pregnant women and older adults have a high risk of developing hemorrhoids. Treatment. If hemorrhoids are severe, a doctor may recommend surgical removal. However, a person can usually treat smaller or less serious hemorrhoids at home. Home treatment. This typically involves using a hemorrhoid cream such as one that contains phenylephrine, taking over-the-counter pain relievers such as acetaminophen, taking sitz bath. When treating hemorrhoids at home, eat a high-fiber diet. Drink plenty of water. Avoid rubbing the area after bowel movements. Avoid straining. Avoid using perfumed soaps and other products. Anal skin tags. Anal skin tags are collections of excess skin around the anus. A tag may feel like a small lump or buildup of tissue. Anal skin tags can result from hemorrhoids or healing anal fissures. They typically do not cause symptoms, but rubbing the tags excessively can cause discomfort or mild bleeding, and larger tags can cause other symptoms. Treatment. Before treatment for anal skin tags can begin, a doctor must diagnose the underlying cause. This may involve surgically removing a tag. Pimples. Pimples can form on the anus, typically when one or more pores become clogged with oil and dead skin cells. A clogged pore may fill with pus, resulting in a pimple. An anal pimple may feel like a soft fluid-filled bump. Irritation can cause these pimples to become sore or otherwise uncomfortable. Do not pop these pimples, as doing so can result in infection. Treatment. To treat or prevent anal pimples, keep the area dry and clean. Refrain from shaving or waxing the area. Eat a healthful diet. Anal warts. Anal warts are growths of tissue that result from infection with the human papilloma virus or HPV. Anal warts can be small, measuring 5 mm or less, but they can grow and some spread over the anal opening. They are typically skin colored. Some symptoms of anal warts include bleeding, a feeling of fullness or discomfort in the anal area, itching, mucus discharge. Treatment. Treatment of anal warts depends on their size and number. A person typically uses topical medications such as those that contain podophyllin and bichloroacetic acid. HPV causes the majority of anal cancer cases and nearly all cases of cervical cancer. It is crucial to receive treatment for anal warts. It is also worth remembering that 90% of HPV infections clear up within 2 years. Anyone who thinks that they may have anal warts should consult a doctor. Molluscum contagiosum. Molluscum contagiosum is a viral illness that causes lesions called papules to form on the skin. The papules may be clear, yellow, flesh-colored, red or pink. They are firm and typically smooth and domed. When Molluscum contagiosum is transmitted through sex, these lesions commonly develop on the lower stomach, upper thighs, anus, and genital region. A person may have only a few papules or many that vary in size. Treatment. Molluscum contagiosum sometimes goes away without treatment, but this can take several months. To treat Molluscum contagiosum, a doctor may recommend a topical ointment, many of which contain podophyllitoxin, salicylic acid, or potassium hydroxide. Remove papules with laser or by freezing them off. Anal cancer. Anal cancer involves cancerous cells being present in the anus. The cells may collect to form a mass or lump, though this does not always happen. Some other indications of anal cancer include changes in bowel movements such as passing very narrow stool, discharge from the anal area that may be mucus, pain in the area, rectal bleeding, rectal itching, swollen lymph nodes in the groin. A person with any of these symptoms should talk to a doctor. They may refer the person to a gastrointestinal specialist who can perform an examination and recommend further testing. Treatment. Treatment of anal cancer can involve chemotherapy, radiation therapy, surgery.